Great to have you with us. Now, 8 of the 9 Boko Senior High Technical School students in the Upper East region who were admitted on suspected meningitis have tested negative for the disease. Their colleague died yesterday in the latest outbreak of disease in a senior high school. A student from Timpani Senior High School in the area is also on admission. That was the latest case that we recorded as of yesterday. Now, this week, Boko, Damongo, and Koforidua Technical Senior High Schools and 4 from Kumasi Academy have recorded deaths linked to either the H1N1 swine flu or meningitis. This morning, many students across the country are currently receiving medical attention after exhibiting similar symptoms of H1N1 and meningitis. So let's get the latest from Boko and Timpani. We've been joined on the line by the doctor treating these students, Dr. Clemento Pong of the Presbyterian Hospital in Boko. Good morning, sir. Thanks for joining us. We understand the students from Boko have tested negative for meningitis. Are you testing for any other disease?
So far, our focus is on the meningitis, because you know the students who died had confirmed meningitis, and once we did the school with other students, they said the same. They have common rest. So our focus is on the meningitis, and once we rule out meningitis, then we can test for other things. But now we are focusing on making sure that these patients don't have meningitis, which is an epidemic we all don't want to get to.
So are they still under treatment?
Yeah, they are under observation, actually. The only one that is under treatment is the one from the St. Anthony High School, who is still in a critical condition. But the rest are under observation.
Right.
We are keeping eyes on them.
So when you say under observation, what do you mean?
No, we are checking their vitals, looking out for signs and symptoms of meningitis. As I said, there was a student from the school who died from meningitis, and once they are there, they have common risk, as I said. So it is possible that they have it, but it evolves with time. So we have to keep an eye on them to make sure that they don't get to meningitis. Meningitis is not a death sentence. Once you get meningitis and report early, meningitis can be treated. What causes most meningitis deaths is that they report a little too late, or when they come to hospital, we don't pick it early. So once these students have come and they are showing signs, we have to make sure that if there is meningitis, we have to pick it up and then manage it as soon as possible. That's what we are doing.
So, doctor, does that mean that now there's nothing to fear?
At all. There's nothing to fear. The investigations we have done, as you said, on 8 of the patients, prove that there is no meningitis. But at the same time, I don't want to give a false hope to anybody that there is nothing wrong. Because as I've said, the earlier you report a meningitis case, the better the chances that you will survive. So we don't want to give any false hope to anybody that there is nothing going on wrong. We want as many as feel they are sick to come to the hospital for it to rule out that there is no meningitis. And that is what we want to encourage as many students as possible to come.
So there's that possibility.
There's nothing to fear. But at the same time, I don't want to give false hope to anybody that nothing is going on.
Right. So there's that possibility, from what you're telling me, that another student from Boko Senior High Technical School or from Timpani Senior High School could be affected by the disease.
Yes, it's possible.
Right. Thank you very much, Doctor. We'll be coming back to you for more updates on this matter. Let's go on the other line and speak with our Upper East correspondent, Albert Sorry, to find out, try and understand how the authorities, education authorities in particular, are dealing with this matter. Albert, thanks for joining us. What more do we know about these outbreaks in Boko and Timpani Senior High Schools?
Okay, so for now, what we know is that apart from those that are on admission, no case has been reported yet. And what the school authorities are also doing is to try and calm the students down. Our understanding is that last night the school authorities gathered the students in a bid to counsel them and to advise them on what they could do as far as signs and symptoms and all that are concerned. so that if you are not feeling well or if you feel that you are having some signs that show that you could be sick, you report early and then you will be taken to the hospital. Now, at the moment, the students are writing their end-of-term exam, so the education authorities are also cautious to make sure that this issue doesn't escalate and cause panic such that the students may not be able to write their exam before they go home. So that's what we know for now.
Now, for students who are faced with an examination, I can imagine that it's quite difficult having to balance the possibility of an outbreak in their school versus preparing for an exam.
Yes, especially in the Boko Senior Technical School where a student has died. We understand that a lot of the students, especially those of them who are close to this particular student who lost his life, were traumatized, so to speak. And that was why the school authorities called the students and tried to speak to them and to calm them down and to assure them that everything will be brought under control. But then we still staying in touch with the health authorities and the education authorities as well to see if there are further developments on the issue.
Now, in the case of Kumasi Academy, we saw a lot of parents rush to the school to try and get their awards out. We saw a general dissatisfaction among the parents of these students. Have we seen anything similar with Boko and Timpani?
With Boko, we know that some parents went to the school, but it wasn't as compared to what we heard in the Kumasi Academy case. Some parents have gone to the school to check on their wards and all of that, but they didn't take it too, they didn't panic, and we didn't see so many of them rushing to the school. But we know that some of the concerned parents have gone there to check on their school. Some even had to go to the hospital to see if their children are there first before going to the school.
Did we have any withdrawals from the school?
Sorry, I didn't.
Did we have any parents withdraw their children?
No, we don't know that. We haven't heard of any such case where a parent has withdrawn their word from the school.
Right. Thank you very much, Albert. Sorry for joining us there with the latest update in Boko and Timpani. Right. Now, last night, the Ghana Health Service confirmed congestion in the various senior high schools could be the reason for the outbreak and spread of this disease. This comes after the Coalition of NGOs in Health said on this program, on this platform yesterday, that we have about double the numbers that we have in senior high schools this year as compared to last year. And because of this, health authorities should have predicted or should have known and prepared for the possibility of something like this happening. Let's speak to Executive Director for Institute for Education Studies, IFES, Peter Enti, who believe these issues of congestion and what have you must be dealt with immediately. Peter, thanks for joining us. What is your reaction generally to this outbreak?
Thank you very much. I think that over the years, we have not paid particular attention to health management system in our secondary schools, and that is the result of what we are seeing now. We think that as we go forward, the Ghana Education Service and the Ghana Health Service should try as much as possible to provide at least one medical professional for each of the secondary schools that we have in our schools. This should be done within the shortest to the long term. Again, the issue of congestion should be dealt with during this long vac that the students are going home. We think that the issue of sanitation and the congestion can be dealt with by the realignment of students from some of the schools to other schools that are less congested. We think that if you're able to do some of these things, going forward, we will not experience some of the issues that we are experiencing here, because it's very sad and pathetic that you will take students to a very secondary school, and the next thing that you will get is the remains of that particular student's body. It's very sad.
Right. You talk about two major points: health management in senior high schools and the congestion and realignment of students. About health management, what are the observations you have made on the ground that you feel should not be the case?
Over the years, we have seen that the Ghana Education Service makes it mandatory that schools should have what they call a sick bay or a dispensary. This dispensary is supposed to serve the students in terms of dealing with their health situation. Now, what we have realized by our studies on the ground is that most of these schools do not have this facility. And in schools where these facilities are available, what you would realize that the facility is manned by a student who they call the health prefect. In some instances, a teacher is supposed to take care of it. These are situations that are happening on the ground. And in most of the schools that they even have this, through the help of philanthropists and then the PTA, that they were able to put up some of these facilities. Sometimes some of the facilities are available, but you go there and it is just empty. No drugs, nothing is provided. We are thinking that so in instances where students are sick or report sick, what happens normally is that the student is taken to a teacher in the school, or at worst, the parents of the teacher is called. What this means is that in our schools, we do not have records of the health situation of our students in there, unless maybe the student was taken to a hospital that we will be able to have access to that. That point aside, you know that when you are being admitted into an educational facility, you go through what we call a medical examination. What this medical examination is supposed to do is to assess the student's health in totality so that they can provide some sort of information to the education authorities how to deal with each and every individual student in relation to his health needs. When we went to the ground and we
Right, Peter Enti is the Executive Director for the Institute for Educational Studies. We are trying to re-establish that. But he raised some interesting points there, first of all, about the fact that students are treated by their fellow students in sick bays and infirmaries in senior high schools. That is in a few senior high schools where they have these infrastructure, and in other cases, they do not have at all. He also raised the points that it would be necessary to realign the numbers within these senior high schools in order for us to have less congestion in the senior high schools. We'll do our best to re-establish contact with him and finish with that conversation.